In this video, I will inform you about the disease hepatitis C. You will learn what hepatitis C is, how it is transmitted, signs and symptoms, how it is diagnosed, and much more. What is hepatitis C? Hepatitis C is inflammation of the liver that is caused by a virus. Here you will see a picture of one hepatitis C virus, showing the outer coat, the inner layer, and the virus genes. The causative agent for hepatitis C infection is the hepatitis C virus. The hepatitis C virus is made up of hepatitis A and hepatitis B. Hepatitis C virus is a positive single-stranded RNA virus. Hepatitis C is transmitted by an infected person. Someone's blood infected with hepatitis C virus would have to enter the body of someone who does not have the virus. Ways one is infected are by infected blood, non-sterile needles, sexual intercourse with someone who is a hepatitis C carrier, and babies born to hepatitis C infected mothers. Pathogenesis. The virus must go through 8 steps to complete its life cycle. The first step involves the virus locating and attaching itself to a liver cell. Once the virus attaches to a liver cell, it goes through several steps in the cell until it reaches the final step, which is a newly formed virus that travels to inside the plasma membrane and attaches to it. The viruses that are not destroyed by the immune system can produce hundreds or thousands of offspring. Then over time, this will cause tremendous damage to the liver. This picture shown here is the breakdown of the hepatitis C virus life cycle. There are 2 forms of hepatitis C: acute hepatitis C and chronic hepatitis C. Acute hepatitis C is short-term and occurs usually in the first 6 months after someone contracts the virus. In most cases, acute hepatitis C will lead into chronic hepatitis C. Chronic hepatitis C is a long-term illness that occurs when the virus has remained in the person's body. Chronic Hep C can last a lifetime and cause severe liver issues such as cirrhosis and liver cancer. Both forms of hepatitis C have symptoms, but 70 to 80% of people with hepatitis C don't show any symptoms. Some symptoms for acute hepatitis C are fatigue, vomiting, nausea, fever, joint pain, and some will develop jaundice. Some symptoms for chronic hepatitis C are bleeding easily, bruising easily, fatigue, itchy skin, weight loss, poor appetite, fluid in abdomen, and others with chronic hepatitis C can also develop jaundice. Diagnosis of hepatitis C. Anyone that is at a high risk of exposure to hepatitis C needs to contact healthcare workers to get a blood test. The diagnosis goes along with the transmission of hepatitis C. If anyone falls into a category of someone that can become infected, they should visit their doctor to do a blood screening test. The blood test will screen for the hepatitis C infection. If the test comes back that the patient is positive for having hepatitis C, then they will need to do additional blood tests. They will also test the patient for liver damage. Here is a picture of a liver that has been infected with the hepatitis C virus. The first one is of a normal liver that has just been infected with the virus. Years later, this shows a liver with chronic hepatitis. This is the stage where usually only a liver transplant can help the patient. Next is after the infection has affected the liver for 20 to 25 years, causing cirrhosis of the liver. And the last liver you see here is after 25 to 30 years of infection, causing hepatocellular carcinoma, the end stage of liver damage, causing death. Treatment for hepatitis C. Forms of treatment for hepatitis C are antiviral medications, liver transplant, and vaccines. What is antiviral medications? An agent that kills a virus or that suppresses its ability to replicate and hence inhibits its capability to multiply and reproduce. Antiviral medications are used to rid the virus from the patient's body after 12 weeks of treatment. Liver transplant will only become an option once the patient has reached chronic hepatitis C. For vaccine, there is no vaccine for hepatitis C, but the doctor may recommend that the patient receive the vaccines for hepatitis A and hepatitis B. Prevention against hepatitis C. The way to prevent is by not sharing items with others that are infected with the virus that may have blood on them. Prevention is better than cure.